People do not understand how life works in rural Kansas, in our small communities. And this thought, this perception that we have access to the same resources, the same specialists, the same whatever it may be, is just not true.
The reason why this disparity is important are the long-term effects. Students who are going without school right now are going to have lower educational outcomes. People who are missing medical visits might be missing important treatments or well visits. People who maybe don't have access to interactions with friends are experiencing social isolation. Across Kansas, 3 in 10 Kansans don't have access to adequate internet access. And if we don't start taking steps now, then we might get to a point where the gap is so wide that we're unable to create the equity.
So here at Quincy Elementary, we are in North Topeka, and our community is a pretty needy community. About 93% of our students come from families that live in poverty, and that's pretty typical of the community, the surrounding community of North Topeka, and so we have lots of needs here.
When the pandemic struck, we were kind of lost, like how do we address those issues that we weren't prepared for.
So we had students out in front of the school connecting to our Wi-Fi. We had families in cars parked in our back parking lot because they could get the Wi-Fi in our parking lot.
And it just showed that they wanted to be in school, they wanted to do the work, but lacked that ability at home.
We've had a lot of students who, even through Zoom, we could just tell, they'd have their hoodie up over their head, or we could just tell that things were just not quite right for them. And so having that internet was really the only lifeline that they still had to us. And so that was vital that we get that to them. And, we could just see them losing kind of the sparkle in their eye.
I saw this every day. I noticed when students don't have a device or don't have internet, that impacts their ability to do their work. And then he compares himself to another student that is doing something really well, and kind of like, is it because I don't have this resource, or is it something about me? That's really sad.
Mineola, as a community, is home to approximately 800 people. Probably about 40% of our population is going to be geriatric. Mineola has never had reliable internet services. The internet service within our community was horrid, and that is the only way to say it. We had patients who would have to go to another individual's home or go someplace else in town where they could get a good internet connection so that they could connect for their telehealth visits. They just did not have that access at home. As a hospital, our fear was if we could not keep up with the technology that's out there that is heavily dependent upon the internet and cell phone usage, is that we would lose our reputation in the community as being the pillar of this community and helping to hold things together.
Our mission here at Quincy is to remove barriers for all of our students that keep them from an equitable education. And we're going to need something bigger than Quincy to be able to do that.
So we addressed that issue by seeing what resources were available in our community, and we got some hotspots and some low-cost internets, and we're offering those to families so that they could address those issues.
Our providers would go to great lengths to be sure that they were able to connect with their patients. So the number of countless hours, additional time that our healthcare providers had to remain here at the hospital. There were weeks where it was significant.
After we gave these resources, we saw a lot of those students really participating in their schoolwork and their Zoom sessions for class.
Things in Mineola are beginning to improve little by little. We are very thankful that the city proper of Mineola appears to be taken care of through having some fiber laid, but we still need to recognize that there are portions of our community and even some of the surrounding communities who are still behind and are at risk of falling further behind until they receive an adequate internet provider.
We're seeing progress in this area. The state is putting funds towards building the broadband infrastructure. And so I do think that there is ways that we're moving forward in this. There's just a long way to go still.
The pandemic didn't create this issue. It was there before. Once the pandemic came, it just highlighted those issues and just made it more prevalent that there's that gap between people that have this resource and people that don't.
It may seem like a small thing, but it's huge. Our families don't have access to a wealth of information. They don't have access to communication. And there are just so many other opportunities that people with internet have that our families don't have.